Welcome back to Good Morning San Diego. Nearly half of Americans now have high blood pressure. Why? This according to some new guidelines released by the American Heart Association. The study says millions more Americans are now considered to be in the high blood pressure category. And here's why. The Heart Association redefined high blood pressure as a blood pressure reading of 130 over 80, down from this old standard of 140 over 90. What the heck does that mean? I don't know. Let's talk to a neurologist, Dr. Sara Siavoshi. Let's tell us a little bit about what those numbers mean. One is systolic, the other is a diastolic. I don't really even know what that really means.
Sure. So just to start with defining what these numbers mean, the systolic is the number on top. So when you go into the doctor's office, you see on the blood pressure reading, there's a top number and a bottom number. The number on top is the systolic, and it is the pressure that's on the blood vessel walls when your heart is pumping.
Okay.
The number on the bottom is called the diastolic, and it's the pressure on the blood vessel walls when your heart is relaxed.
All right, so what happens in a hypertensive situation where you've got really high blood pressure? That means that the walls are stressed, or what's going on there?
The walls are stressed, and it causes a whole cascade of events that significantly can increase your risk of damage to those blood vessels, leading to an increased risk of heart attack and stroke. So that's why this is such a big issue.
Okay, so your body's only designed to take so much blood pressure, and if it increases, you could create problems like, for example, in your brain, and that's what when you have a stroke. Tell me what happens then.
Yeah, so interestingly, even if you haven't had a stroke, I have plenty of very young, healthy patients in their 50s, early 50s, who come to me and I get a brain MRI on them. And the radiologist reads it as something called white matter changes, and they say, what the heck does this mean? Right. And I tell them that essentially what it means is over time, your little tiny blood vessels in your brain were damaged because of high blood pressure. And they say, well, doc, I never even had high blood pressure. So this new blood pressure parameter may actually be a good thing because of that. So now people will be managing it more aggressively to sort of prevent that little blood vessel damage in the brain.
So if it damages the brain, it's got to be damaging other organs, specifically your heart, and that's what causes heart attacks. How does that happen?
The heart, the kidneys, absolutely. So the way in which it leads to heart attacks is also pretty significant, where it can weaken the heart valves, it can weaken the heart musculature, and when your heart's not pumping as well, it can lead to a collapse of that organ.
Right, so a lot of folks are taking medications, and I'm sure that if you have somebody that's in your practice and you say, look, your blood pressure's too high, I need to prescribe losartan or something like that. What does that medication do? Because I think this survey may in fact be sponsored by one of these companies that's saying, look, we need to prescribe more to keep people's blood pressure down. What do those drugs do?
So there's drugs in many different classes. We have them in the beta blocker class, propranolol, metoprolol, if you've heard of these drugs. We've got the ARBs like losartan. We've got these ACE inhibitors like lisinopril. These are all really popular drugs. They all work in different ways to lower the blood pressure. And one source of controversy over this has been, how low do we want to go? How much do we want to treat people, especially our elderly patients? Because we know that being on too many medications can increase dizziness, falls, which we talked about last time.
Right.
So that is something that's sort of been a source of contention in the medical community. But interestingly, this study actually showed that the group that they more aggressively lowered the blood pressure in, where they lowered the top number to less than 120, did not have a significant increase in dizziness or falls. So their side effect profile was actually not greater than the group in which they lowered the blood pressure less than 140.
All right, let's put the medicines aside. What can we do naturally to help ourselves and improve our blood pressure?
And I think that that's the biggest thing that this is calling for, is public health awareness, that all of us need to be doing conservative things in which we can naturally lower our blood pressure, which is weight loss, low salt diets, limiting our carbohydrate intake, limiting our alcohol intake. These are all things that we can naturally do where we don't actually have to resort to blood pressure medications.
I'm thinking to myself, no fun.
Yeah.
Well, but you do have to have your mindset's got to change, right? Because a lot of us are so set in our ways that we don't change, and that could actually kill us.
That's exactly right. That's exactly right. So, you know, I've had patients that lose 20 pounds and they're able to get off of their diabetes medications, their blood pressure medications, and significantly lower their risk of these serious diseases that we know can lead to death.
Well, we appreciate your insight so much.
Absolutely.
Dr. Sara Siavoshi, thanks so much for being here with
Thank
us
you.
this morning. We'll be right back with more Good Morning San Diego in just a moment.